to start the meeting, and we're going to be joined in by Joe McCormack from NICE.
That's brilliant. Thanks ever so much, Dudley. I've got a short presentation, some of which is just screenshots, so I don't think it'll take long, but I'm just going to share my screen now. Can everybody see that? What I normally do, just to start, is that people know that they can use the chat and they can put anything in the chat at any stage during the presentation. So I just want people just to take a minute with the chat. If you have access to that, depending on what device you're on, please just write for me one thing you take with you on a desert island. Are you able to see the chat, Dudley?
See the chat. I'm not sure if there has been some other people sharing the screen, so let me see if I can just take others off who are sharing the screen. So if anyone can't see the screen, what you should see is a slide which says what's one thing you can see from here. So if
what's one thing you'd take with you on a desert island?
Yeah, sorry about that.
Great, just checking.
I can see that. I'm not sure if there's other people who are actually sharing their screen. So let me just, so you should be able to see that. If anyone can't see the screen, please let me know. So we should have just yourself sharing your screen. So hopefully that everyone should see that. If anyone can't see the screen or can't see the being said screen, please put in the chat box so that I can adjust it if need be.
That's great, and I can see some people have put some things in there. Bottle of water. Yeah. I love the one about the Swiss Army knife and sunscreen. I do ask this just at the start of all of my sessions. Mobile phone, gosh, it's going to be hard to charge. Somebody would take company, and thanks, Sue. It would be your husband. That's good to know. No, that's great. So the chat's available all throughout the presentation, and we'll get to it. If we don't get to it during the talk, we'll get to it at the very end. So that's brilliant. Please feel free to use it. I'll be interested to know how comfortable you are with NICE, if you've used any NICE products, or if you have any queries about any of those. So my name's Joe McCormack. I'm part of 10 people who work at NICE as part of their field team. So we do have national coverage, but because there's not many of us in the team, we tend to work regionally. I predominantly support the Midlands and East, but I do work very closely with Jane Moore, who covers the London region. I've got Jane's email at the end of the presentation, so she'll be able to pick up anything after today if need be. But that's me. So a key message about today is going to really be quality of information from NICE. And when I talk through a little bit about NICE, I hope you'll see that it's largely a go-to place for the NHS, for health, social care, public health, and really it saves you time in terms of Googling where you won't necessarily know the quality of that information. So I'm going to show you how to find what you need from NICE. I'm going to use an example for what NICE looks like and what's available. And it's always easier to pick a topic. So I've picked managing medicines in care homes. Some of you may already have seen that guideline. We published it in 2014. But what I'll show you regarding that example applies equally across all the topics for NICE. So I hope that'll be helpful. I'll show you some of the tools and resources that accompany a guideline, a quick guide, because those guidelines can be quite comprehensive, so they can be quite big. And I'm going to show you a practical resource that some registered managers have used recently. It's called a quality improvement resource for social care. And that's where we've taken our NICE recommendations and we've mapped it to the CQC key lines of inquiries. And I'll show you how to find that on our website. And then finally, I've just got a slide about the easiest way to stay up to date with us. So NICE, the National Institute for Health and Care Excellence, it's an independent organisation. It is funded by the government, but we sit independently of that, so we can't be influenced by that. And it's our role to provide this evidence-based guidance for health and social care. So our guidance, standards and other resources help health, public health and social care professionals in order to deliver this best possible care within the resources available. NICE is at the heart of the health and social care system. We work closely with local and national organisations, and together we encourage and support this quality and safety focused approach in which commissioners and providers can use NICE guidance and other NICE accredited sources to improve outcomes. So really it's all about us working together, using skills, judgments and the evidence to help deliver lives better lived. So our social care guidelines make evidence-based recommendations on the effectiveness and the cost effectiveness of approaches and services. It's co-produced with social care experts and people who have lived experience of using services. So what we do is we review all the available evidence on a topic and we make these recommendations describing what's effective, so what works, and what improves people's experience of care, and what's cost effective, so best value for money. And we produce these guidelines. And where there's a gap then in some of those recommendations being followed, we look at perhaps 3 or 4 of the main ones. They're the most common gaps. And they're as part of a quality improvement tool. We've got them as a quality standard. So there are 3 or 4 statements and we say, if you want to improve quality, look at our quality standards. They're the most common gaps that people aren't doing from our recommendations of what people should be doing. And if you followed those, you may already be following them, which is great. And you can evidence that. But if you're not and you follow those, you'll be making the biggest quality improvement that you could. Because our guidelines are quite comprehensive and we do one guideline for all audiences, whether that's professionals, the providers, as well as commissioners, as well as the general public, as well as everybody in health. So it's one guideline and they're quite comprehensive. So what we've done for social care is we've worked with Sky and we've produced social care quick guides. And they're just the key main recommendations, the most important ones in order to follow on a topic. So I don't know if anybody's seen any of these. If you have and you've used them, please put it in the chat. A couple of years ago, we did one on oral health for adults in care homes. And it was about the time that the CQC were inspecting 100 homes for oral health. And that quick guide has an oral assessment tool, just a sheet, very visual, that you can print off and keep in people's care plans. And I do know that that's been really popular and very helpful. And I know from just a conversation earlier this week where a manager had done that before a CQC inspection and that had been praised by the CQC. So we've tried to make it easier in terms of how comprehensive these guidelines are by pulling out these quick guides. They're free, you can just print them off the website. They are very much used for new members of staff or if you have external visitors. We've got one on infection prevention and control, delirium, advanced care planning. We've got a couple of recent ones that I've just pulled up at the front because we've got a safeguarding guideline and we've got a couple of quick guides associated with that. So I don't know if people have used them before, but they're a really sort of great resource that summarises those key guidance. So why use NICE? A care home manager recently shared that they use NICE guidelines as a benchmark for their service delivery and for improvement to their service. They use NICE guidelines in their team meetings to study a particular topic and improve knowledge of the staff, but they also use it as a resource for preparation for CQC inspections. So I just really wanted to share that. If people haven't seen, this is the NICE website. This is our homepage. We've got a yellow bar across the top, which is everything that we've said that's related to COVID. So we've now got that on a separate page if people wanted to see that. You can search the website by typing anything into the search bar at the top. So you could just type quick guides and our list of 20 quick guides would come up and you can have a quick look through that. But you can put in a clinical topic if you want to know what we've said about that. You can search our guidance by area. It used to be on the right hand side of the page, it's just on the left. I've just pulled up a red box on that. You can look at conditions and diseases. So if you wanted to look at heart failure or you wanted to look at gout, you can look at population groups. So you could look at people with learning disabilities or vulnerable groups, or you could click on settings. And if you did, there's various different settings that would come up there, but the particular one you may be interested in is care homes. If you clicked on that, this is a page where we've got everything together for anything that we've said related to care homes. So you wouldn't miss anything, and you can just scroll this page in reality. It starts off with our guidance, our quality standards. Sometimes it's a news article. Sometimes it's shared learning, where people have used NICE and made a difference, and we like to really promote and share that story. You can see it on the right-hand side of the slide as a pathway, and it could be that you want to go to just one particular element of somebody's journey, or maybe you want to look specifically at just training for safeguarding. So you can go into pathways and you can look at one specific element of it. So just by way of just showing people a little bit about our guidelines and what NICE looks like, I've just got a couple of slides. I happen to, just as an example, chosen this guideline, whose purpose is to provide recommendations for good practice on the systems and processes for managing medicines in care homes. And it's for all people who have that collective responsibility for residents' care, ensuring safe and effective use of medicines in care homes. Oh, it's quite busy, this slide, isn't it? Pretend that arrow's not there at the moment, all that red box. This is a typical landing page for a guideline, managing medicines in care homes. We've given it a code, SC1. We've published it in 2014. We've got a list down that left-hand side, and one of them is recommendations. And although the screen only shows 1.1 to 1.6, in this particular guideline, it goes 1.1 to 1.17. And I've got an arrow there just because I've pulled out what we say in section 1.6 about keeping residents safe. It happens to be from a safeguarding example there. And you can see it's broken down into those individual little recommendations. It, for instance, recommends a clear process for reporting medicines, that the process should be recorded in a care home's medicines policy and what should be recorded there. It also talks about monitoring for trends, finding out root causes, sharing findings with everyone. This particular guideline also talks about risk assessment for residents, for their ability to self-manage medications, and does list what that might cover. So it would talk in detail maybe about resident choice, whether self-administration would be a risk to other residents or to themselves, whether the resident can take the correct dose at the right time in the right way, how often you would repeat a risk assessment, how medicines would be stored. So you can see the guideline does go into quite a lot of detail there. On every guideline page, we always have a box that says tools and resources, and I just wanted to show that because we tend to group everything here that you may find useful, whether that's an endorsed resource, there's the e-learning modules about medicines use in care homes, whether we've got a quick guide that goes with it. And for instance, on this particular one, we've got the checklist for the care home's medicines policy. And this is just what that checklist looks like. So it may be that you want to just have a very quick check to see, regarding what we've put there in the checklist, that your policy may be up for review, may be worth checking, and be able to say that it's in line with NICE as well and what NICE recommends. And you can see in the blue just on that right hand side that we've actually linked it to those individual recommendations that we've made. Again, on our homepage of our website, we do have a dedicated area for social care. I've just put the red box round what we do. And if you click on that, you do find our page on social care. And again, you can scroll this, and just a little bit further down, we've got tools and resources that may be helpful for social care. The one particular one I was going to mention today is the quality improvement resource. And this is what it looks like. So you can click on any of those domains there in terms of the key lines of inquiries and the prompts that follow that. I don't know if anybody has looked at this yet. If you have, can you please put it in the chat? I'll be very interested to hear. But if you, for instance, you can click on well led, either at the top or the bottom, and I've made this quite large, but it is quite comprehensive, and it does work its way through all of those prompts across the top. And we have mapped exactly what NICE has said in any of its guidelines or its quality standards as evidence for meeting those key lines of inquiries. And I've just pulled up a couple to hope it's not too blurry and that you see it. So it could be a statement from our quality standard about employees feeling valued, having the opportunity to contribute to decision making through staff engagement forums. Maybe your organisation did these virtually over the last year. It could be our guideline on managing medicines in care homes and having a clear process for reporting medicines related safeguarding incidents, and that the process is recorded in your medicines policy together with what it states there. It could be a review of medicines related problems over time to identify and address these trends that may have led to incidents. It could be documenting the circumstances and reasons why a resident refuses a medicine. So I hope you can see that by following the recommendations in our guidelines, you're demonstrating well led, and you can do the same for any of those other key lines of inquiries and look at those. I've just, again, back to the homepage for our website. I just really wanted to flag that we have access to the BNF directly from our website without having to log in. It's automatically there. It has been made suitable for any devices that you may be on, and you don't need any sort of login, and it's free and available directly from there. And then I don't know if anybody knew, but we have a YouTube channel where we've got some recorded videos, the very short videos, and we cover quite a lot to do with social care within those. So it may be an opportunity that you may get a chance to look at something like that. And if you wanted to stay up to date, NICE does produce a monthly newsletter specifically for social care. So if you subscribe to that, it would just come through on email, and it would detail anything that we've published in the last month, whether it's a quick guide, whether it's a new guideline that we've just written on safeguarding adults in care homes, for instance. But we do also put in there, if we're looking for any people from the field, any professionals, any experts, or people to comment on a guideline that we're just about to write. So we initially ask for people to be involved in that if anybody's interested, but then we also ask for comments when we've got it in draft. So you can comment on a consultation regarding a topic that's going to be very relevant for social care. And we do encourage people, what we've produced needs to be very useful, it needs to be timely, it needs to be helpful, and so we do seek that information. We do have a general inquiries line at NICE, but I have put Jane Moore's email there in case you wanted to follow up on anything else from today. And as a whistle-stop tour, that's NICE in a nutshell. I would say that reputationally, we do some work internationally now, and very few countries have anywhere near what we've got with NICE. We have been working for 20 years to hone our process of reviewing all that available evidence to enable people to do evidence-based practice. We're very open for feedback on that and how we can make it easier, but we are there for you. And we work very much with Public Health England and the CQC, not complementing what other people produce, but very much working alongside them.
Thank you very much, Joe. That's really been very comprehensive. I'm sure if people weren't aware what NICE did before, they'd probably actually have more of an understanding. I think many people have been aware of the NICE guidance and guidelines and probably always think of medicine when it comes to NICE. But it shows that you're so much more. And also I will say that NICE has developed and come a long way. Before it was a website with lots of information, but I love the fact you also have a YouTube channel as well with videos, because that's one of the questions that have been asked prior, that they would like to see more videos around some of the standards and that you've obviously produced. So really thank you for that. It really would now ask anyone if they've got any questions in any shape or form that they'd like to ask Joe. Joe will try her best to answer it, or I guess if she can't answer it, come back and let us know the question she can't answer at all. So please, anyone who wants to, you can either raise your hand or I may be able to unmute you. So please, any questions, or you can leave it in the chat box and I'll ask away. Okay, so one of the questions that that someone had posed before is that you mentioned that you give recommendations out for various parties, and that would be things such as the regulators and other governing bodies. Do they just take your recommendations from it, or do you? Or is it just, or do you mentioned you sit just alongside of them?
So we sit alongside them, but I think it's sort of well recognised that we have reviewed all the evidence on that topic, and we've published those recommendations which we know to be safe, effective and best practice there. So as a national guidance, that's what you've got. You've got NICE there. And then we do know that the CQC will often look to what we've said, and then to help inform them when they go to do their inspections. We do know that, as I mentioned, we pull out some of the things where people perhaps haven't been following those recommendations. What's the key things that a lot of people are missing there, and we've put that as a quality improvement tool, haven't we, as our quality standard. And we do know that the CQC, and I know they'll be able to comment later, but they did look to that to see how are people looking to improve all the time and to show that improvement over time. And I suppose it's looking at yourselves to say, okay, we've got that guideline, what gaps have we got where we don't do that? Is it something we should be doing? Over time, let's look to address some of that. And if it's in the quality standard, it's a few statements. It could be that you choose to do those first because there's 3 or 4, so it's not overwhelming. So I'll very much say that we work together, but they do look to NICE because we have done that background work on what would be best practice.
Okay, thank you for that. Any other questions that someone may want to ask in the group at all? Right. You mentioned the one that I've got a question in the chat box which says you mentioned about having BNF made available within NICE. Does that mean that we as care homes are not necessarily required to keep hard copies in individual homes?
Oh, no, I've had that question before. It was a little while ago. There was something, I don't know whether it came from CQC, but there was something in terms of saying that people should have a hard copy. What I would say is demonstrating use of it, if it was that you'd taken the decision to use what's available online. It's good to know that what's online is absolutely the most up to date. And what you've got in hard copies is something that's updated every 6 months. So you really should be following what's available as the very latest, and the very latest is on the website. But I recognise that some things with the digital age, some things have been a bit slow to keep up with that, and there may already be, you might be able to remind me, Dudley, whether there's actually a I vaguely remember there somebody saying from a care home, but we've been told that we have to have a hard copy. And I suppose if your computers went down, if you had no way to access that, what would your default be? It very well may be a hard copy, but to bear in mind that may be out of date.
Yeah, I would say, just to back you up there, Joe, that you should have a hard copy at all cases, in all situations, just in case. And the most latest um, that you've got in there. And usually with most of us with policies, they probably have to be signed off and reviewed as well. So it would make sense that you at least showed that you reviewed it. And if you have that hard copy, you can also say, as well as using the hard copy, you've also gone to a latest source of information as well, because as we know, these are changing times, and I think keeping up with everything will be very difficult. So, but definitely to have a hard copy. And a lot of people have policies with other organizations, or maybe write your own as well. It's also good to have that in as well. So thank you for that. Also as well, I think we've got another question here, and this is from Jason. You showed on the slide that the Chloe's for safe, effective, etc. What evidence should we have to demonstrate this? And is this the evidence after discussions with CQC, or information NICE thinks CQC is looking for? So I guess this is down to you.
Oh, you showed on the slides, you did it, and what evidence we should have to demonstrate. Is this the evidence after discussion with the CQC on the information NICE thinks the CQC is looking for? When we put this together, it's a few years old now. I think it was 2018 when we put this together, and we do consult closely with the CQC. I wasn't involved with putting that together, but I do know that people have used it and recorded that as evidence, and that's really helped them with the preparation for CQC, and they felt really pleased to be able to do that. Whether it's something that NICE did the mapping, whether we consulted with the CQC about it at the time, I don't know. But I've not had any feedback from the CQC to say it's not, you haven't nailed this. We very much, we are obviously, having written those recommendations, really acutely aware of that. And we can see that that's an example of where that evidence is for you on that topic.
I agree with what you're saying. I think the question I think people would ask is, can we reference, for example, the source of NICE to an inspector and that using? I think because everything has to be shown of where it's come from and it's written down, I think most people would like to go to a source and be able to reference that.
Yeah, I think you would be well set to be able to show that recommendation, because then they know that you're aware of that and that you've read it, but your evidence will be very specific to your organisation. So it will be, you would reference that recommendation, say for instance about the medicines care home policy, and then it will be about your policy. And if you've not then reviewed your policy to see if it's in line with NICE, then it's not going to match. But if you have, and that's been signed to be able to say, we've checked this on this date and it's in line with NICE. So you've got the practical evidence there, you've got the link to the recommendation, achieving that element.
Okay. Thank you for that answer, Joe. I hope it answers some of your question, Jason. If not, you can add some more questions into the chat box. Another question that had been asked, since the pandemic has taken place, what has NICE done? I know you showed us various things with COVID to keep up with the ever-changing guidance and legislation that the government has sort of laid out to us.
Yeah, there's a couple of points on that. On the homepage, it really, COVID did take over very much so. We've now just put it as that yellow bar, so you can click in there and you can see the work that we've done during COVID. So when the pandemic hit, NHS England asked us to publish on very specific topics that were COVID related. They were called rapid guidelines. Usually the guideline process would take us about 18 months to publish something. They said, we want you to turn it around in 2 weeks. And we did. And we did it for, I think there's 21 in that collection now, which showed that NICE could very much improve the timing and review that evidence. What we found was, especially with the pandemic, is evidence was coming out thick and fast on a daily basis. So we're reviewing those all the time, almost live, to keep them up to date as evidence changed, and obviously as it became available and in the public domain. So We do review all our guidelines as evidence emerges. They're on a rolling cycle and a programme. The COVID ones we reviewed on a daily to start with, and then weekly basis, and now it's currently on a monthly basis. We got our work directly from the government or from NHS England, and we very much were conscious about not duplicating work that was being done by others. So largely Public Health England, who were producing the guidance about what type of PPE to wear and how to source it and what to do if it wasn't available. So we didn't say things that are in somebody else's remit in terms of public health, but anything that we felt was in NICE's remit, we have published on, and it's all there in that yellow bar. Does that help?
Yeah, that's a great answer, Jo. Does anyone else have another question they'd like to ask? I've got a few questions that were given to me, so please feel free. Now's a chance to speak with Jo and NICE before you go off, so that you have clarity of where NICE, as I said, sits, what their role is, and how you can use and make the use of NICE as well. I will leave the NICE, I've already put it in the chat earlier, but also will leave the actual web link for the site for you to go through in your own time as well. Whilst people may be thinking of a question, there is a question that a lot of people ask, and that's about templates that people want to use and adapt for their own organizations. And so a question that came up is, does NICE give templates for people to adapt for their organization?
I suppose it depends what sort of template people are needing. On every guideline, under tools and resources, we have something called a baseline assessment template. If you wanted to see a snapshot in time of where your service is now, associated with all those recommendations in the guideline, we have a template for that. It's just a simple Excel spreadsheet. I say that there's a few extra bits on there that you'll know, but it does list all of those recommendations, and it gives you columns where you can write if you cover it, if it's a gap you've got, what actions you want to take with that, and that's well used in health. It is available as well should you want to use it in social care, if people want to do that. Because it's an Excel spreadsheet, you can play with it, you can merge cells, it's there for you. NICE doesn't have to see it, it's there for you if it's useful to you. So it's a tool that we've done, and you can absolutely play with it to meet your needs. So I didn't show that today, but it is on there as every guideline landing page. It's called Baseline Assessment Template.
Thank you, Jo. I think another question I think Fatima's mentioned in the chat, where she says, I wonder if anyone actually does a COVID risk assessment template, so nothing is missed.
It's interesting, yeah. Laura's just come back to say Skills for Care have that.
Indeed. One of the things which is very topical has been the vaccine, and obviously guidelines, NICE and so forth. I'm not going to get this into a vaccine debate today, because I'm sure we've been through many of them. So where does NICE sit with all the guidance around the vaccine and obviously those taking it and so forth?
It's not a cop-out answer, Dudley, but vaccine really isn't our remit. We are, a lot of what NICE does is about the drugs and making drugs available. And since COVID, we've worked very closely with the organisations to do with research and development in order for them to be able, once they have got a drug, to be able to get that available to the system as quickly as possible. So, or some of it was promoting, NICE actually putting its name to promoting things that we knew, like the dexamethasone, not a new drug, but very much applicable in that scenario. So we were definitely doing that, but we recognised very early on vaccine hasn't been our remit, so we didn't get too involved in that, but we're supportive of the organisations that have been taking that forward. Thanks
for that, Jo. Are there any last questions that anyone would like to ask? Someone's in the chat was, can you please share the link to the the baseline assessment Excel spreadsheet that you mentioned. I'm not sure if you've got that available.
I'm just going to share my screen again for the
Yeah, you can.
slides.
So you can show. Yeah.
Let me just see if you can see it on the slide that's got the home page. I should have done it more wider, shouldn't I? That was it, I think. Let's see if it's on there. So when you click on a guideline, you can click on tools and resources. So this is an individual one for every guideline. So you click on tools and resources, and can you see just over here on this right hand side, it says baseline assessment tool. So that baseline assessment tool is individual to that guideline. And you've got one of those on every guideline. Is that helpful?
Well, I hope it is. I think we will put the actual website in the chat as well. I think it's thank you. I think a good if you just before you stop sharing as well.
Oh.
No, that's fine. It's also good to know that there's education tools there. There's webinars as well, and there's also case studies as well that people can look at as well, which if they're not aware of. I know we're touching on specific things today, but there are a raft of things that NICE do offer for people to look into. And obviously, if you want to go further, obviously you've mentioned a YouTube channel, and there's some various interactive tools which people can use as well.
Very much so. And I suppose the only thing at the bottom of that in the middle for the tools and resources, shared learning information, we've got about 800 case study examples. You know, it's all topic driven of where somebody has used NICE and done an improvement in their service, and they write it up, and we have awards every year and we put it on the NICE website. So we've got quite a national platform to be able to showcase your organisation if you're able, and you know you want to follow that, or you know you've done a really big improvement that you're really proud of. You know, other people struggle with exactly the same things that you struggle with. So if you wanted to share that story, there is that opportunity there.
Thank you very much for sharing the screen. And a question I think that I'd like to ask before you go is, going forward, what's the future of NICE? And now that with everything that's going on, is there something that we probably are privy to that you might be able to share with us going forward?
That gives me an opportunity, Dudley, to sell NICE, doesn't it? So NICE is 20 years old, and we do work with a 5-year strategy. And in fact, in April this year, that was up for renewal. So we've just published our new 5-year strategy. There is a link to it on the website. What we focused on was the fact that people largely want to see the evidence that's there, because they want to know it's up to date. They want NICE to be much more timely. So we do know that we can't take 18 months to write a guideline. We know lessons from the pandemic is we can do it faster than that. So our strategy really focuses on producing things much more timely, and actually, rather than showing it as individual topics, very much that reflects a patient who may have comorbidities. So really those guidelines need to be interlinked. People can't go to the guideline on diabetes and then go to the guideline about a leg ulcer and go to the guideline about the fact that they've got COVID at the moment. We need those to talk to each other so that when you click on them, you can click on the relevant bits for what people want. So we've got a programme of work in order to try and integrate our guidance. So it's much more realistic for the care of residents who've got more than one thing going on, which is just about everybody, and it's much more timely. So we'll have something called living guidance. So as the evidence comes out, it's very much updated within that.
Sounds fantastic. And is this going to start taking place almost immediately, or?
Yeah, so we trialed using a different app for publishing some of our recommendations. So we had 7 COVID guidelines and we've merged them all into one recently. And we use something called the Magic app to be able to list those recommendations. And that's because internationally everybody was using that. And as the evidence changes, that app is updated and that recommendation is updated pretty much live. So you can see on the landing page of a guideline that there's update information, so you know it's been updated. You can click into it, it says this is new, so you can see the new bits that are on it. So we're very much looking for how can we speed up our processes, keep those lessons that we wanted to keep from what we learnt in COVID, like everybody else, and be able to get that out into the system as quickly as possible.
Thank you very much, Joe. That's really been informative. I think we've had a full start to finish and the future of going with NICE as well. So please, if anyone wants any further information, we will be sharing. I've shared the actual website on the chat box, so please go in there and play around with it. And if you have any further questions, you can send information in the chat box, or we can send Jane or even Joe further questions that you might be interested in. But I would say please go in there and have a look. But thank you very much for joining us, Joe, and giving us a raw sort of overview of NICE.
It's quite all right, Dudley. And if people think actually they can't remember what to click on where, if it's useful to have the slides, I can send the slides, Dudley. I'm happy for you to circulate those.
Thank you very much. We'll be updating it on our news page as well, so everyone can have that. Thank you again.
Brilliant.
Okay. Bye, Joe.
Bye. Thank you, everyone.
Bye. So thank you very much. That was really great information and quite informative of all the things that are happening with NICE. From one organisation to another, we work alongside Skills for Care, and we always are trying to update and keep you in line with lots of practices that are taking place within social care. Also as well, lots of training and other events that are happening. Skills for Care are quite up to date and probably working in tandem with you, or trying to be as reactive as possible. And so we've got Laura here in today, as you're sure, our locality manager, Laura Anthony. And Laura, I think you can share your screen. You should be able to if you want, and be able to show what's happening with Skills for Care presently.
Everybody see my slides okay? Those come up, Dudley?
Yeah, I think it's come up, Laura, it's fine. So you should be able to go ahead.
Lovely. Okay, so morning everybody. At a previous meeting, some managers said that they'd find it really useful to have some guidance and some tips about achieving an outstanding CQC rating. So that's something I'm going to be touching on today. I do understand though that this isn't perhaps a priority for everybody at the moment. You've got so much on your plates with COVID and everything else that's going on. So much of the information I'm going to share should also be helpful for when you're wanting to either maintain or achieve a good rating as well. So not just outstanding. And I'll also be talking about some of the free resources available from Skills for Care, which you can use to prepare for inspection. And that includes the transitional monitoring approach that the CQC is using at the moment. We have things like self-assessment checklists. We have action plan templates, which may be helpful. So I'll send you the link to all of those. And like Jo said during her presentation, do feel free to use the chat at any time, any comments, any questions. I may not be able to pick them up until the end. I'm not very good at multitasking, but do post things and we'll have a look once I'm finished talking. So I'm going to do a quick activity to start, and I'm not completely sure how this is going to work virtually, but I'll give it a go. So can I ask you to put a virtual hand up? So if you go to the reactions option, it's at the bottom of my screen, it may be at the top of yours, or put your actual hand up if you prefer, or just keep a mental note. But what I'm going to do is read out a list of statements, and if you think that these relate to your service, can you please keep your hand up? If there's a statement which you don't think relates to your service, please can you put your hand down and keep it down until I've finished reading through all of the statements. Hopefully that makes sense.
Do you also want to give them the option to say yes in the chat box as well? I'm not sure.
Yeah, of course. Yeah, thanks, Dudley. That's a good idea. Whatever's easiest to you. It's quite a difficult one, as I say, to do virtually. Okay, so the statements. So keep your hand up or put yes in the chat box or whatever you'd like to do. So our managers and leaders have a good understanding of CQC regulations, and ensure that everybody complies with them. So I can't see the chat, so I'm not sure what the response is, but I'll keep talking. So the second statement, the core values of our service are evidenced in everything that we do. And next one, as the registered manager, I deliver hands-on care alongside other care staff. As the registered manager, I have an open door policy. Our organisation has established close links with the local community, and we continue to forge mutually beneficial relationships. The next one, we learn from mistakes, take appropriate improvements, communicate these, and can show the documentation to prove it. The service delivers innovative approaches to meeting the needs of people who need care and support. We continually review and plan for improvements and clearly document and evidence these. And finally, all staff would recommend the service as a good place to work. So I can't see what people have said, but hopefully some of you have still got your hands up. Some of these statements are applicable to your organisation.
There were lots of yeses in the chat box as well, Laura.
Fantastic, so that's really good. Yes. So the purpose of this exercise, each of these statements actually relate to what Skills for Care has found to be some of the most common characteristics of adult social care services that are rated outstanding for well-led. And we know this is our information team, and also myself and my colleagues as locality managers very regularly analyse information reports just to get information about best practice, what people are actually doing to get that rating. So you as managers will know whether or not these statements are applicable to your organisations, but are you confident that your staff would know what to say if they were asked about any of these areas? And do you know what evidence could be provided if your organisation had an inspection while you weren't there? I'll talk more about evidence in a moment. So some of the kind of key characteristics of outstanding services. Unsurprisingly, to get an outstanding rating, you need to have leaders who are committed to delivering high quality care and support and making the necessary changes and improvements to actually do this. And I'm very much focusing on the well-led key question, as if a service isn't well-led, it's going to be really difficult to actually achieve an outstanding rating for the other 4 key questions as well. But some of the things that the CQC is going to expect for your leaders to be at the forefront of a strong and visible person-centred culture. They're going to be asking that areas for improvements aren't just welcomed, but actively sought through ongoing engagement with others. So that could be the people you support, it could be external partners such as health professionals. They'll also expect leaders to deliver upon stretching but realistic objectives and to be effectively inspiring their staff teams to achieve these alongside them. And also very much leading the organisation in striving for excellence, seeking out the latest best practice, new technologies, and seeking out opportunities for learning as well, and keeping your knowledge up to date, which we're very much doing by being here today. And these are just a few examples. I'm sure you've got many other suggestions about what makes outstanding leaders, and do please put them in the chat. So outstanding managers, and obviously lots of overlap between managers and leaders. Lots of what I've just said is applicable to the registered manager role as well. But some of the common characteristics we're seeing of managers who actually work in outstanding rated services are they're very hands-on and visible across the organisation. So staff and the people who are being supported know who they are. They inspire their teams to deliver the best care possible. They really know how to delegate and empower others to make decisions and manage the service when they're not around. So in the event of a CQC inspection, for example. A key one is that they're very well connected with other registered managers, which you're doing again by being here today. And they're also well connected with the wider community and healthcare providers, and very much work together to improve outcomes for people who need care and support. And open and transparent about challenges and issues that their service faces and learn from incidents. I think a really important one is that as managers, you're very much committed to your own development, not just the development of your staff team. And Skills for Care can really help with this. We've got lots of CPD modules which registered managers can access. We've got some leadership development programs that you can enrol on as well. And in many cases, you can get all of these free of charge. There's any money spent you can claim back from our workforce development funding. And I know John Buttle from Social Works Limited is here on the call today. And Social Works Limited do deliver many of these courses and modules. So do have a chat with him and he can help you get the money back as well. So we've got a good and outstanding care guide, Skills for Care, which we developed a few years ago, but which we update quite regularly. You can download this from the link at the top of the slide. But this guide actually draws on learning from over 300 inspection reports. And for each of the key lines of inquiry, it's quite a large document, we give recommendations to what you need to be doing to get an outstanding rating or what you need to be doing to get a good rating. And it's quite a helpful resource. There's also some case studies in there showing what outstanding and good rated providers actually do to achieve that rating and to maintain that rating. And something that's also really helpful, I think, is that the guide gives some information about some of the most common pitfalls that prevent services from actually achieving that good rating, from achieving that outstanding rating. So what not to do as well as what to do. And we know that if you want to achieve a good or outstanding rating, you need to be well prepared for your inspection. And there's information again in the Good and Outstanding Care Guide about how to prepare, so you can really showcase what you've actually achieved since your last inspection. And just a few pointers I've pulled out of the guide. And you may have seen this already, but the CQC actually publishes a document which outlines the characteristics of different ratings. So you can see at a glance, against all of the key questions, what you need to do to have an outstanding rated service, what you need to do to achieve a good rating. And so that's on our website, and it's really, really helpful just to have that to refer to. And you can really see what sets the different ratings apart. So what you need to be doing differently to get outstanding as opposed to good, or what you need to be doing to achieve good as opposed to requires improvement. Really helpful. But we know that the CQC won't actually tell you what to do. It's up to you to decide as managers where you are now and what you need to do to improve your rating. And just some things you can do, perhaps look at some reports of outstanding rated services. You can pull out some really helpful information from those. Maybe visit or arrange virtual calls with managers from local services with that outstanding rating. And I think I mentioned this earlier as well during the activity, but just a really good idea to get regular feedback on your service from multiple sources, whether that's internal or external, just so you've got that data and that information to make continuous improvements. Of course, it's crucial to make any improvements and changes and embed these well before your inspection. So you can show the CQC what you're planning to do, and that will show your commitment to improving. But showing what you've already done and actually evidencing the outcomes will really influence your rating, and that's applicable to good as well as outstanding. And of course, as well, preparing your staff for inspections. So maybe doing a mock inspection or mock interviews, or just talking in team meetings about some of the things that the inspector may be asking. And inspections are looking very different at the moment, as we all know, but many of these principles and tips do still apply. So in terms of evidence, so between inspections, which I'm sure you're all doing already, just collecting evidence to show what your service has achieved, and in particular how it achieves the characteristics of an outstanding or a good service. And if you get the time, I know that's not always possible, just reflecting on this quite regularly to make sure it's really containing your strongest examples of best practice. And make sure as well that your evidence presents a picture of consistent care. When looking at reports, it really comes across that inconsistency is one of the most common factors of services that are rated requires improvements. And also make sure that anything you do is really well documented. You can't just tell an inspector about what you did. They want to see evidence of what it was and also the impact it made. So moving on to the transitional monitoring approach, which was introduced last October as an interim approach to inspection during the pandemic. And this approach is being used by the CQC to help them risk assess services and potentially identify whether or not a face-to-face visit is required. But the focus of the TMA is primarily on safety, how effectively a service is led, and also how easily people can access the service. And I'm sure you'll know there's a shorter list of queries which inspectors will be using, and these are the ones that they're seeing as the most important in the current situation. So they won't be using the full framework, it's a reduced list of queries at the moment. So at Skills for Care, as part of our support for managers, we've developed a video which gives an overview of this new approach, and it also gives some information about what inspectors will actually be looking for and asking during these calls. It also gives some suggestions about what evidence it would be useful to have at hand for each of the queries that are being inspected. And it's about 70 minutes long, but it is divided into different sections, so you can just fast forward to the one that will be most applicable or most useful to you. And I've got the link to all of our resources, including this video, on my last slide. They're all in one place. You can go and have a look and see what might be the most helpful to you. So I've pulled a bit of information out of the video just to show you some of our suggestions about the evidence that you could be showing inspectors. And as I've said, we do have this information for each of the queries, but I'll just touch on a couple now. So as part of the TMA, we know that inspectors are going to be looking at most areas of SAFE, and query 2 is one of these. So we think for query 2, some of the evidence that would be useful to make available to the inspectors would be up-to-date risk assessment documents. I put in the chat earlier that Skills for Care has a range of risk assessment templates and guidance which you can access if you need to update what you already have in place. So there's care plans, also evidence that you're meeting the accessible information standards, and evidence of how you assess for communication needs and how you then plan to meet these needs. Also accident and incident reports, so where you've clearly recorded what actions you've taken and how this is communicated to others both inside and outside of your organisation. And then we've got query S3, which is all around ensuring you've got suitable numbers of suitable staff to support people to stay safe. So evidence you can provide here, an overview of your staff team. And if you've got a Skills for Care RSWDS account, you can very easily pull off a report which gives an overview of all your employees, the hours they work, sickness, many other fields as well. Or you may use an HR system which allows you to do something similar. So training and induction records, just to show that as well as having sufficient numbers of staff, you have staff with the right skills and knowledge. And it'd also be useful here to show records of supervision and appraisals as well, as these are all part of staff development. And can you demonstrate how you're addressing the well-being of your staff to avoid high numbers of sickness absence? Voters, really useful evidence to show, dependency tools if this is something you use within your organisation. And of course, there's business continuity and contingency plans. And again, we've got some templates of these that we can share with you, if that would be helpful. To accompany the TMA video, we've also developed some templates for managers to use. And firstly, there's some self-assessment checklists for each of the 5 key questions. And these are actually based on the CQC's rating characteristics that I mentioned earlier. And you can use these to review your practice, to get an idea of whether or not you're providing good or outstanding care. And this is part of one of the self-assessment checklists for the SAFE key question. It's for Chloe S1, and this checklist looks at the characteristics of a good rating for this particular Chloe. So you'll see in the first column, this gives you an indication of what the inspector may ask. In the next column, you're given information about what good looks like. And you're then asked to think about whether that applies to your service or not. So do you have effective safeguarding systems, policies and procedures? Are investigations thorough? And if you're saying no, and you're asked in the final column to then have a think about what actions you may actually need to take to achieve that standard. So we've got checklists for the good characteristics, and we've got checklists for the outstanding characteristics. And I'd recommend probably starting with the one for good. And if you're saying yes to most of the statements and questions, do then have a look at the outstanding one and look at what you can achieve or are already achieving from that as well. So hopefully that will be useful. The other templates which are available are action plans, and these are also available for each of the Chloes that are going to be inspected as part of the TMA. And this is the action plan for Chloe E7, and it asks you to record what evidence you have currently to demonstrate you're meeting the standards. It also asks what action or change you may need to make or put in place, and also what resources you'll need to do that. And these action plans can actually be good pieces of evidence in themselves. It kind of provides an audit trail which you can show the inspector of all the changes and all the decisions you're making, the reflections you're making on how your service is operating at the moment. So a good source of evidence in themselves. And again, these are all on the website, and I'll put the link up in a second. I just wanted to finish by letting you know about some other sources of support available from Skills for Care around meeting CQC requirements and preparing for inspections. So we've got a guide for managers which really focuses in on the CQC standards around recruitment and retention, learning and development, and leadership and management. We have a website called Care Improvement Works, and for each of the Chloes, we've gathered together some resources from ourselves, Sky, and also NICE, which you can use to help you meet that particular Chloe. And we can offer consultancy and tailored support as well. So that could be coming into your service, working with you on a one-to-one basis, identifying any areas where improvements may need to be made, helping you put steps in place to actually address those improvements. We can also run seminars for your staff. So that could be on preparing for inspection. It could be on preparing new managers to understand CQC requirements. And if you have a rating at the moment of inadequate or requires improvements, we can run a seminar on actually how to put improvements in place and achieve a good rating. So the link at the bottom of the slide here is where you can find all the guides, all the templates, all the other resources. And anything you can't find or want to chat through further, please contact myself or Selena, who's the locality manager for North West London. Okay, I'll stop sharing my screen. I can work out how to do that. And are there any questions at all from anybody?
Thank you very much, Laura. I think that was really great. All the information that you had sort of shared, and very comprehensive, and very interactive as well. I will ask for questions. But before I do, just as well, Laura, you mentioned during your slides that there is some funding available. So I know that probably you've covered just all the things to do with the standards and inspections. So if you could just really sort of touch on that as well.
The funding I mentioned is Skills to Care's workforce development funding. Some of you are probably aware of it already, as we've been distributing this for a number of years now. And it's for adult social care organisations to develop their staff. So you can claim funding for qualifications such as diplomas in health and social care, apprenticeships, smaller qualifications in topics like dementia, stroke care, end of life care, and also leadership and management development programmes. And there's also some smaller CPD digital modules which managers can access. There's modules for new managers, more established managers. There's a real range available, but John, say he's on the call, if you have a chat with him, he can actually let you know what they can deliver, and he's be very helpful in terms of actually getting that money back. Anybody who wants to know a bit more, do get in touch with me as well, and I can put you in touch with the local funding partnership in South West London.
Thanks,
and you can claim retrospectively as well. So if you've completed or your staff have completed any qualifications since January, you can probably get some money back for those. So do get in touch.
Thanks, Laura. So has anyone got any questions they'd like to ask? I'm going to introduce John in a minute, but any questions that anyone wants to ask about Laura's presentation at all?
And all the yeses in the chat, that's fantastic.
Yeah. It's all to do with inspection, and everyone's always scared when it comes to mentioning that topic. One thing I will say before anyone does ask me questions is that we do know that now inspections are back. They also are asking people to fill out their PIR forms as well, as we saw from our last meeting from the inspector. Yes, inspections probably are still in transition, and CQC are still finding their way. But what hasn't changed is that everything is evidence-based, and if it's not written down or it doesn't exist, then you may be marked down. And CQC haven't changed the way they inspect, even though the pandemic has changed the way we're working. So using as many resources as possible, free is really important. So to prepare yourself, which Laura's mentioned, it's always great to have things in place. So yeah, I'd like to just make that point very, very clear to everyone. So please, anyone who wants to ask Laura a direct question, you can do. And one of the questions, Laura, they did ask is, will the slides be made available? And yes, they will be. We will share it via our Lcas news page, where you can go on and you'll be updated, and Peter will send it out and to you all personally.
I'll send you the updated version, Dudley. I think I've updated a little bit since I last sent them to you.
That's fine, Laura. If you send it to us, we'll make that available for everyone. Does anyone else want to ask any questions to do with the slides? Okay, I think we've got one here in, which says from Fatima. We had a registered managers meeting last year, and we were told that now providers have the responsibility to complete PIR yearly. Or we still have to wait for the invite. Yes, you also have to wait for the invite. What happened at the moment presently is that CQC are sending out PIRs to different organizations at different times. They are slightly different now, and it's meant to be slightly improved. For anyone who's had the PIR may be able to answer that question. And I believe, and this is the words from one of the chief leading inspectors in the country, and I wouldn't take, and he said that even though the PIR forms are coming out, presently they are not mandatory, but they are used as a guideline and a lead on to an inspection. So I would use that clearly to fill out as much information as possible, because usually what is the case is once a PIR form comes in, we do know that inspection is something that is going to come soon afterwards. Yes, this inspections may be slightly shorter, but the evidence is still going to be required all around. I hope that helps, Fatima. And could you give us a bit more information about how closely you work with CQC, Laura, personally?
Quite closely, actually. Our kind of senior managers meet regularly with their counterparts in CQC, and locally as well. We have very good relationships with inspection managers and inspectors, so we do go along at Skills for Care and perhaps present at CQC team meetings about our resources and supports. We let them know about things like our workforce development funding, so they can share that information when they go out and inspect. And so we do a lot of analysis of CQC reports, we feed into their strategies. So yeah, I think quite close working relationship.
Does that mean you update your information as much as possible in line with?
We do, yeah, it's quite fast moving. I think like NICE, we have to make sure we review it regularly just to make sure.
So I would say to everyone that sometimes you may have to, because everything's changing, to go onto the website and Skills for Care and probably give it maybe 24 hours from when things have changed. But they do have lots of videos and also a whole history of past videos as well in their on their website as well, which you can actually go to as well, Laura, I believe.
I was going to say as well, I don't know if people get the CQC newsletter, but next Thursday they're running an hour webinar on their strategy, which I assume is going to include information about their new approach to inspection and regulations. So it might be a helpful thing to sign up to if you're free on that date. I'm going to be going along myself, so I can share information afterwards if anybody, if that would be helpful.
We'll make all the information available for Skills for Care onto either the website, email, or those on the WhatsApp group to be given that information as well. Dana asked a question. It was regards to PIR. Has it always come, or can this come after the inspection? CQC were inspecting services which they had concerns or concerns were raised, and if that be the case, they will just turn up in inspection rather than giving you out, asking for the PIR. But usually you are given a PIR beforehand. You must remember as well, there are lots of things that are changing presently and they still will change. And what we say today may change shortly. We'll update you as many changes as possible as we also meet with CQC with many updates. We'll keep you informed. But presently, CQC will inspect any services where they feel there are concerns or raised. So be aware, the PIR doesn't necessarily come beforehand before the inspection automatically. Does anyone else want to ask any other questions at all with Laura's slide? And I think in light of the previous question, how do you think CQC will change their approach to inspections in light of the pandemic? Good question. And I think CQC, at first, obviously, we know that they did the virtual meetings and they also spoke with people having the conversation. What CQC have said is that they are looking to come to actually go back to face-to-face visits. They have given a sort of a general overview that inspections, even though they're going to be similar as before, there will be lots of information that can be done virtually and can be sent across as well. So I would say, as Laura mentioned, prepare as much information as possible. So the more information that you have in place, you can send them. It may make things a lot easier. But to date, obviously considering the pandemic and obviously safety concerns, I think they will try and visit and inspect as best as they can. But I think it's forever moving, the government's easing lockdown and the various sort of challenges that may come with that.
I think it'll all start becoming clear over the next kind of few weeks and months, and hopefully the webinar I mentioned next Thursday will start giving some idea of what the changes will be.
Yeah. Okay. Are there any other final questions that would like to ask for Laura at all? Okay. Right. I
I
don't
see
know
that.
if you can answer this question. I can give an answer after you, Laura. So feeling. I'm not sure if you read the question, Laura.
I did, yeah, and I really hope so. And certainly when I've been to events where the CQC have been presenting, the inspection managers or head of inspections for certain areas have been very sympathetic and very understanding of what co-organisations have actually faced in the pandemic, and really admire kind of resilience they've shown and everything they've done. I mean, I know that's not perhaps the case for everyone, but certainly those people I have seen speak of. And I think the people who've had along to these meetings as well have been very understanding.
I mean, I will add to that, Laura, as much as they will be understanding what CQC will be doing, any areas of concern, and that specifically doing things like infection control, they will be really coming down harsh on. So you have and would advise to have things in place which shows that, especially around the pandemic, your premises are safe, secure, and you've adhered to all the changes that have taken place during the pandemic. CQC are looking at that area and they're looking at it closely. So as much as they may be understanding of your situation, if you haven't adhered to any of the guidance, guidelines or changes, it will be picked up by CQC. And in the chat box, I've been said that CQC have had they've had a recent CQC infection control inspection recently. So I would also just remind you that CQC are going to be looking at that area very closely. Any other final questions for Laura? Okay, thank you very much for that, Laura.
Oh, you're welcome.
Before you shoot off, Laura, one thing I wanted to add was that you mentioned training. There's various organizations that CQC do recommend and work with, and there's various training happening because, as we know, training is also one of the key areas that CQC look at. We've got John Buttle, who's here, and he's just going to give you a sort of an overview of where training is at presently and with his organization. John, you're on mute.
Yeah, thanks, Dudley. Yeah, just to say, we've been working with Skills for Care on WDF funded courses for about 10 years now. We're a Skills for Care endorsed provider, and I should say other providers are available. But yeah, since the pandemic started, we've shifted everything over to doing a mix of virtual Zoom seminars, and then people have time to complete workbooks in their own time. We've probably put about 1,000 new care staff through training in that fashion in the last year. We run a 4-day session that starts every Thursday, and that is for new care staff. And the first 2 days, the Thursday and Friday, cover level 2 medication RQF. And then we use the funding that's available for that to subsidize the Monday and Tuesday, which covers all of the care certificate knowledge criteria except basic life support. So we do this, as I say, every single week. It generally works pretty well. Most people seem to cope with the technology, and especially nowadays. And so if anyone's interested in signing up to that and is already linked into WDF, then please let us know. If you're not already linked into the Workforce Development Fund, it's a good time to start looking at getting your data set ready and everything in advance, because the new funding year starts on the 1st of June. So there is nothing stopping you getting training now and then getting everything ready following that. As well as training for new staff, we also do fully funded level 2 dementia awareness course. We also do a fully funded level 2 autism awareness course, and all of the Skills for Care endorsed management courses, which includes the Well-Led and the Lead to Succeed and a whole load of 1-day CPD modules too. But I've put a link, well, it was probably a while ago, on the chat box now. And please have a look at the website or just get in touch. my email address is on via the website, and I'll just put it down here as well. And if you've got any questions, please let me know.
Thanks for that, John. It's really good because if people obviously have had their heads heavily into their organizations, pandemic, COVID related, and probably forgot about the everyday things. And as we're sort of easing down, we can understand that all these things are still required, or they have still been required going forward. So thank you very much for that. Thanks for that, John. Also as well, I ran a poll very briefly about staff and staffing concerns. As we know that, and it may change, that furlough may be coming to an end briefly. And so staff, or some staff may want to come back, some may want to not to come back at all. And also as well, we know that the other organizations and other different sectors are going to be taking away staff that may have come to organizations, and so that pool of staff may be less. So on the poll we sort of did briefly, it said about 57% of those said that they do need staff, and of the people needed in the about 57% as well said they needed 5 or more staff. So you can understand that there is a huge range of staff needed within this sector. And I think the problem that most of us will say, it's not just staff, we want quality staff and staff who have some understanding. I know there's various apprenticeship schemes. We've had someone coming here from Care Friends. We've also got Skills for Care as well, who are offering different choices for, I think it's the Prince's, is it Prince's Trust? I'm not sure if that is what it's called, where there are sort of, where you can access staff as well. So we hope to do an event on staffing and all places where you can find staff and where to go to. And it's probably something that you probably will require. And we'll see if we'll run it for the next event. If not, will definitely be in July, and where to go to and how to attract staff as well, which is probably going to be a key thing that we do need. So I thank you for that as well. As time is running out, I'd just like to thank you all for turning up for this event. It will be shared via the actual various things on the website. So I'm going to post in the group just if you haven't already, there's a leadership course with Skills for Care. There's also some information as well, how to get in contact with both Peter or I. Peter's had a break today, much needed, and but you can contact us directly by email or by phone, and we'll try and update you with as many things as possible. We still do meet with CQC ourselves, and the web page updates you with weekly, if not daily, updates of what's happening with the guidance. We also have been running a project for sort of health and well-being and mental health called Keeping Well, and we have had various training and things that have come from the back of it. So we will update you with that. So please, if not by WhatsApp, email, or please go to the website that we'll update you with. And we thank everyone for coming along and hope you enjoyed the session. Please stay safe and keep yourself well, and we'll see you at the next event around this time next month. Thank you very much for everyone. I think Laura probably is, people are asking you for a few bits of information. You've got your information there, but everyone take care. And once again, I'll see you again this time next month. Thank you.
Thank you, Dudley.
Bye, everyone.
Bye.
Thank you, Laura. Thank you, John.
Bye.
Bye.